We don't talk about assignment making as much, but you still may see assignment making on NCLEX. Now, these can be formatted many different ways as well. Sometimes we might be asked to assign a nurse to a specific client or assign a nurse to a specific unit, and sometimes we're asked to assign a client to a specific unit to make sure they have the care they need, because that is a huge safety issue. So this one is going to be us assigning a client to an appropriate unit. So it says the medical surgical nurse is caring for the following clients. The nurse should recommend a transfer to the ICU for which client? Okay, so let's talk about this very briefly. On the medical surgical unit, this is typically stable clients, and we are looking to determine who do we need to send to the ICU. And ICU, once again, is the critical care setting where it is the sickest of the sick, okay? So, option 1, pneumonia and requires frequent administration of IV antibiotics. Option 2, a new colostomy with redness and excoriation at the colostomy site. Option 3, warmth and drainage at a skin graft site following a traumatic burn injury. And option 4, COPD with a pulse oximetry reading of 92%. And all of you guys are guessing one option, which is 3. So let's see if you're right. So option 1, pneumonia requiring frequent administration of IV antibiotics. This is a stable client, and we should be able to safely administer IV antibiotics on a med-surg unit. Now, let me give you an example of when we would transfer this client. Maybe they are experiencing dyspnea, or they are experiencing tachycardia, or they have an elevated lactate level. So what did I just describe? What clinical condition did I just describe? If I have a client with pneumonia who is tachycardic, has difficulty breathing, and now has a positive lactate level or an elevated lactate level, what are we thinking about? Because I know y'all all have probably guessed the right answer, but I want y'all to get some more learning from the wrong answers. So that's a pop quiz. Pneumonia, positive lactate, dyspnea, and tachycardia. What am I worried about for my client? It's going to be sepsis. Yes, very good job, Valerie. Yes, wonderful, guys. So in that case, I am shipping them to the ICU. So I can do hemodynamic monitoring. I can try to keep them alive, right? Option 2, a new colostomy with redness and excoriation at the colostomy site. So this client is a brand new colostomy, so we know that that comes with a lot of issues related to comfort, potential for infection, and this client's experiencing redness and excoriation. It could be just normal irritation, but also could be sign of an infection. Now, at this time, there's nothing to indicate they're hemodynamically unstable. There's nothing that says they're experiencing tachycardia, fever, anything like that. So I believe they are also safe to remain on the med-surg unit. Then option 3, warmth and drainage at a skin graft site following a burn injury. Okay, so remember, we send people to ICU if they're hemodynamically unstable or if they require specialized care. So clients with a skin graft typically require specialized care because it's a very high-risk procedure. There is a high likelihood of rejection, and typically they need specialized burn care. So I agree with all you guys that so far 3 is looking like the best option, but let's check out 4. Option 4, COPD with a pulse oximetry reading of 92%. So why am I not concerned about that? Because 92% is outside of the normal range. So we anticipate a client with COPD to have a decreased pulse oximetry reading. We know that damage to that lung tissue can affect oxygenation. So that's actually an expected finding for this client. Now, if I gave you the example of a pneumonia client with the pulse oximetry reading that low, that would be different. But for this client, it is expected, it is chronic. I think we will ship that one to ICU, and we got that correct.